In this video, I will go through sending an eReferral using Healthquest. The first thing I'm going to talk about is the Health Service Catalog, and that is a catalog of all the possible combinations of the reason for referral, the potential specialty that they can see based on that reason, and then based on the specialty, which locations are available. This is updated every night automatically via Healthquest. Should you want to do it manually, you can go to this setup here, click Load AH Tables, and there's a number of different tables checked off here. We're going to uncheck everything and just have the Load CII Coding Tables checked off. And we're going to click Go, and that will refresh that health service catalog that the eReferral is going to be using. So as a provider, while in the patient's chart, you may do a letter or a form based on the referral that you're sending. So if I was to click on Forms, and I have my referral form here, all the information is filled out. I'm going to click Save with Ref. This is going to attach this form to my new referral. So I'll click OK. And here we have our referral, and I'm going to set the job class to receptionist, and I'm going to select my doctor. As a provider, when they're logged in, it will default to them as the clinic doctor. From here, if that's all the doc wants to do, they can click Save, and the referral coordinator or the receptionist will take care of the rest. You can see the form attached here. So as a referral coordinator who is taking care of this referral, they will see the form, identify what the reason is, and enter that in the reason for referral. So if I type in pain, and you can select from the drop down here, I'm going to do wrist. It's going to change this referral method to eReferral, and then down here in the requested specialty, if the reason for referral is only going to go to one specialty, it will default populate that specialty. However, in this case, it could go to orthopedics or plastics based on the reason for referral that I have selected. So I'm going to select ortho. Now, based on this specialty that I've selected, it's going to offer the triage sites that are available. So I'll click on this one. And from here, I have my attachments. I've got the reason for referral, specialty and triage site, the patient information, provider information. The patient is a 23-year-old, so they are an adult. Then I'm just going to click on Send eReferral. Then you will get your eReferral request sent. Click OK. So you can see that it has been sent, the date and time and by who it was sent by. And once they have received it on the other end, you'll get a received by CII and a received by eReferral, and that all happens within the same sort of minute or two. Once it has been received by both CII and eReferral, you will automatically get a referral number ID populated into this field. If it is only received by CII and not yet by eReferral, the referral number will not be filled in until it's been received by eReferral as well. So it won't happen very often where it's received by CII but not eReferral. But in a case like that, it means that the referral has gone to the central access team to be manually triaged instead of electronically, automatically triaged. At that point, once it's been triaged and it's been officially received by the eReferral team, they will then assign a referral number to that referral, which will then populate into this referral ID number. If the patient is a pediatric patient, i.e. under the age of 18, so in this case, this patient is 4 months old, they do require a parent or guardian information attached to their chart for the referral process. So in the client card for the patient, we're going to go to the Relations tab and scroll down, and you can see a parent. You would either click New and search the existing patient as the parent in the lookup, or if they are not an existing patient at this clinic with the minor, you would have to generate a new client card. So you would click New, enter their first and last name and contact information and address, and then you would save it. You'd go back to your pediatric patient client card, click on the Relations tab and Parent, New, look that patient up and attach them as a parent. Then you can click Save and go to the Referrals tab and go through the motions in the same capacity that I just did. And from there, you would continue to track your referrals in the same way that you do normally. So in this case, I'm going to change my status to waiting for a response, and I'm going to post date this to 2 weeks in advance so that we can then follow up to make sure it's been accepted by a specialty.